Sorry to interrupt.
Are we
Ma'am,
go?
should we? That's what. Should we start with the formal?
Yes, please. Introduce you.
I'm so sorry to interrupt, ma'am. Namaste and greetings. I, Avi Sharma, researcher at IMPRI, Impact and Policy Research Institute, Prabhav Evam Niti Ansandhan Sansthan, Nai Delhi, extend my warmest welcome to you all at IMPRI Web Policy Learning. Today marks the seventh day of ending gender-based violence, Cohort 3 Challenges and Responses, an online national autumn school program, a four-week online immersive certificate training course. This program is organized by the Gender Impact Studies Center at IMPRI, New Delhi. The chair of the program, Professor Vibhuti Patelji, visiting distinguished Professor IMPRI. The conveners of the program are Advocate Dr. Shalu Nikamji, visiting Senior Fellow IMPRI, advocate, author, and researcher on gender and human rights. Professor Gumari Sri Devi ji, visiting Professor IMPRI. Dr. Simi Mehta ji, CEO and Editorial Director IMPRI. Dr. Arjun Kumar ji, Director IMPRI, New Delhi. Proceeding further, I heartily welcome you all to the third cohort of Ending Gender Based Violence Challenges and Responses. Your valuable time, energy, and contribution towards addressing and engaging with this critical challenge are sincerely appreciated. We have also shared the course outline and reading resources via email for your reference and perusal. Before we start today's session, here are the housekeeping rules for the session. It is imperative that you join the meeting on time. There will be a Q&A session after each presentation. Share your questions in the Q&A box and not in the chat box. The questions must not be posted as an anonymous attendee. Ensure that all your questions are precise and refrain from making general comments in the question to save time. To begin the day, I would like to invite a chair, Professor Vibhuti Patelji, for her opening remarks.
Yeah.
Ma'am.
So, very good evening to all of you. On the day 7th, I think we welcome you all. First of all, we express our heartfelt thanks to conveners of this course, Dr. Arjun Kumar, Dr. Simi Mehta, and the coordinators, Ms. Priyanka Negi, Ms. Vaishali Singh, Mr. Satyam Tripathi, and Stuti. And today's moderator for the whole course, Ms. Avi Sharma. We welcome today's experts, Dr. Anant Bhan, Ms. Anoushka, and Advocate Audrey DeMello. A brief overview of what all has happened in the previous uh, 6 days. First of all, we began with the overview of gender-based violence and how it has been what has been the contribution of the women's movement globally as well as in our country. Keynote address by Flavia Agnes raised so many pertinent questions, and she profiled women's movement since 1980s with the national level solidarity for the teenage tribal girl Mathura, and which resulted in amendments in the rape law and also some of the procedural aspects, and the burden of proof was on the accused rather than on the victim. She also gave a very important dimensions of Protection of Women from Domestic Violence Act, PCPNDT Act, the glorification of Sati, Prevention of Sati Act in 1987, which all resulted because of a consistent campaigns and research and public debates by the women's movement, health rights movement, and the human rights movement. Day two, we had Dr. Keerthi Bollineni, herself a survivor of a domestic violence, who spoke about the need for building solidarity and addressing inequality. And she called this whole new movement against gender-based violence as a renaissance. And she said this is a renaissance for the women's right and gender equality. And she also showed a video film of her organization, Vasavya Mahila Mandal, which was formed in 1968 by 3 women, including her mother. And she said that no silence for violence, that was the motto, and has been the motto of Vasavya Mahila Sangathan. She also said that only support to the survivor of violence in terms of the legal support or accompanying her to the police station is not enough. We need to provide the livelihood support, and that's why her organization also collaborates with National Rural Livelihood Mission, then the State Livelihood Mission, and so many economic programs which take care of right from ration to employment and to the care of children And they say that it is very important to provide physical, emotional, sexual, economic, psychological support and fight against the violence and sexual violence. She said that whether it is in the marriage or in the community, we need to create a very strong solidarity, and that's why her organization has 840 volunteers, out of which 80 volunteers are men, and they all are mentored. They are trained to handle the individual cases, and individuals do the hand holding of the survivor. She ended her presentation with a very famous quote of Mahatma Gandhi, that it is good to swim in the waters of tradition, but to sink in them is suicide. That means the whole tradition of subordination of women or the gender inequality has to be challenged. Dr. Albertina Almeida's presentation and her very erudite talk was on sexual harassment at workplace. She gave a whole history of women's organizations fight against sexual harassment at workplace even before the law was in place. She started with the whole episode of Bhavri Devi's gang rape and what all transpired after that, right, at the police station and the session court, in the High Court of Rajasthan and Supreme Court. She also talked about the Rupan Bajaj, IGP, IAS officer, who was publicly harassed and by the DGP of Punjab in 1997, and she consistently fought for 30 years to see to it that DGP, who was lionized as a national hero of Arjuna Award and all, he was also had accountability. She also talked about the aftermath of Nirbhaya tragedy and the public mobilizations which resulted in a Justice Verma committee report, and she applauded the women's manifesto of women's liberation, which Justice Verma committee gave. And she also said that still it is a work in progress, because when it comes to marital rape or the rape by the army or those who are in the force, they are still not brought to the book, because these are the two categories which are still have a license to rape and use violence, sexual violence. She also said that when it comes to, we need to see the question of sexual harassment as a boundary of decency, and it also, we need to understand that nobody has an entitlement to woman's body, and or any person who is perceived as a weak, because it is the gender minorities that also face sexual violence, and bodily autonomy is very important. And then we had a session very next day, the fourth day, we had a presentation focusing on adolescent girls and the violence faced by them. So my Yagna Parmar, director of Vacha, she spoke on empowering adolescent girls and pathways to address systemic and structural violence, and the Vacha's initiative of last 30 years, how it has empowered hundreds of girls who were earlier just a victim of child marriage. The moment they started menstruating, their parents would take them to the native place and marry them off. But after Vacha's multifaceted intervention in the community and consistent work since 1992 resulted in so many, the community also having a faith in Vacha, and Vacha also partners with Majlis, Sneha, Childline to fight against gender-based violence. Then we had a very important presentation on the whole history of PCPNDT Act and the methodology, the historical methodology of witness seminar, which was utilized by Dr. Indira Chakravarty. She gave the first-hand account of what all those who were involved in Forum Against Sex Determination and Sex Preselection, Doctors Against Sex Determination and Sex Preselection, members of Medico Friends Circle, did build the campaign against sex selection, and she gave a whole historical chronological unfolding right from 1970 to 2024, and she said the range of concerns about becoming, say, that we have, that if you are against sex selective abortion, it's a very thin line whether you are anti-abortionist or women. The way law is penalizing the women visiting diagnostic centers, that aren't we further victimizing the victim? Or how do we regulate medical practitioners? And she also ended with a statement that India lives in a several centuries at the same time. And she quoted Arundhati Roy, and she said that from visible murder, which used to happen in the 19th century, and the social reformers fought against female infanticide, to a sanitized elimination of girls by highly trained medical professionals who exploited patriarchal social values for commercial gains and all through sex tests. So, and she ended with a commitment that we need to challenge the commercialized medical healthcare ecosystem and provide the alternative. Day 4 was marked by the Advocate Ceiling Thomas's presentation on acid attacks, which has been a very, very devastating experience for women, because even after that, one episode of acid attack completely ruins the life, and it's not only the bodily harm, but also their public life, their series of surgeries that they have to undergo, and the permanent scar which is there on the emotional scar that it gives. She explained the social, legal, and medical aspects of these whole tragic episodes, which are now increasing. Day 5, we had a Miss Anuradha Kapoor, who talked about the support services to the survivors of gender-based violence, and the work which is done by her organization, Swayam. And she also talked about the experiences in the shelter homes, one-stop crisis center, the medical care which is given, the protection officer, the role of protection officer, and the vagaries of legal system, which doesn't, though we have strong laws, but the enforcement becomes become a problem. And she also talked about the very, very anti-women prejudicial biases that even the police officers and the judges and the lawyers have. I think she corroborated whatever like Flavia was saying in the context of Bombay, and she had the context of Calcutta was no different. Dr. Suneha Kandapal, after that, she spoke on trafficking of women and children, and she also talked about the deconstructed the law, PITA, and prevention of trafficking of women and girls. And she also talked about the whole journey of the trafficked person, and she says some of the important spots which belong in Tripura or Samastipur in Bihar, Karnal in Haryana, Jharkhand, Delhi, Maharashtra, Karnataka, Sundarbans in West Bengal. How they are the major epicenters of trafficking, and the vicious cycle of push and pull factors which continue this murky business. And she also talked about the intersectionality of caste, class, and gender in the cases of trafficking, and children which are sent off for monetary gain due to poverty. She talked about. She also talked about the traditional sex working community like Abedia and Bachada in Rajasthan, where the girls are asked would they like marriage or learn the tricks of sex trade from their aunts. So that is, and now slowly the awakening among the girls, and at the initiative of the young girls, who are opposing this kind of degrading custom, some changes are happening. And she also talked about, she ended with a statement that coordination between services must happen, which currently is not happening between the different state agencies. And that is why there is no accountability. And also the shelter homes, aftercare homes, how are they run? Why there is an iron wall of secrecy? And she also quoted the TISS study of the findings of the way shelter homes in Bihar were using these helpless girls as for further, like the sex work and other forms of brutalization that were happening. They were not even given adequate food. So she talked about the psychosocial model, and the community-based model is more important in dealing with the issue rather than just kind of a legal intervention, or the biomedical model where this distressed children and women, when they are rescued, how does the police and the shelter home treat them? On day 6, we had Dr. Amar Jisani speaking on role of health professionals and services in combating violence against women and girls. He, being a pioneer of a Dilasa model one-stop crisis center, he shared the procedural dimension and how the negotiations with the existing public health system at a local self-government level resulted in starting a first Dilasa center, and whole process documentation and participatory action research while training the nurses and staff and of the hospital staff and doctors in a 1,200 bedded Bhabha hospital snowballed into several other states accepting this model. But there are other models also, like Andhra Pradesh has a community-based model for support to survivor of violence. After that, Professor Veena Vaswani, she gave an enlightening lecture on the duty of mental health professionals in support services in gender-based violence. She herself, being a practicing doctor, shared so many experiences of last 30 years of being a forensic expert who had to testify when the any form of gender-based violence resulting into death or resulting into major bodily injury happened. And she said that how she found tremendous misogyny and the biases against survivor and the whole ideology of victim blaming that was really very heartbreaking. And now she, her Center for Ethics is playing a very important role in bringing awareness about these important issues so that we can have a systemic changes in both in the medical practice, in the hospital administration, and also the textbooks. The gender in medical education is also a very important mission, which Dr. Anant, Bhan, Dr. Amar Jisani, Dr. Veena Vaswani, and many others who are active in the whole mission of making gender inclusive medical syllabus. And today we have these three experts, Dr. Anant Bhan, Ms. Anoushka, who will also enlighten us on many important dimensions of gender-based violence. Over to IMPRI team. Yeah.
Thank you so much, ma'am, for providing us with the overview of the past few days of the course. Moving forward, without further ado, I would like to invite Dr. Anand Bhanji, MBBS MHC Bioethics, researcher in global health, health policy, bioethics, and mental health, mentor and principal investigator, Sanghat, Public Mental Health NGO, Bhopal, India, and Anushka Virk, research assistant, I Hear Access Matters, Sanghat, Public Mental Health NGO, Bhopal. They will present their talk on actions against violence and discrimination against women and girls with disability. We welcome you, sir. We welcome you, ma'am. The floor is yours.
Thank you so much, Abhiji. So I'll share my screen now. So to begin, I just want to say that we slightly changed the topic, given that our organization works on queer and disability rights. We felt it was only adequate, as you also mentioned, Professor Vibhuti, to discuss gender minorities with disabilities and the violence that is waged against them. So to begin, to all the participants, I'd like to invite you to scan this QR code. It'll lead you to a Mentimeter poll. Let me know, and I think we can have a couple of minutes to go through that and submit your answers. In just another minute, we'll move on. Okay, so we've had some answers come in. The question that was posed to all of you was whether some disabled people are at more of a disadvantage than others. And I'm very happy to see that the majority of our participants today have voted for yes. And over the next half an hour, we'll try to explain the ways in which some disabled persons are in fact more disadvantaged than others. There's another question that we'd like you to answer. I am putting the link to this Mentimeter in the chat. The question in front of you is, what are some challenges that women with disabilities face? Just want to get an idea of what we're thinking before we dive right in.
Hi, I just want to cross-check if everybody can see the second question because it's still showing the first one on mine.
Yeah, I was, yeah, even I
All
can
right.
see.
Okay, then I'll hand back to Anant, and for the last Mentimeter question, I'll ensure that it's visible to everyone. So over to you then, Anant.
Sure, thanks, Anoushka. Can you restart the slides or share slides again? Great, thanks a lot. And if you could just go to full screen.
Just a second.
Okay, is everyone able to see the slides, or are you seeing any kind of a gray cutoff on the slides?
Yeah, we can
Yes,
see the
there's a
gray cut.
cutoff.
Yeah, okay. Anushka, is there a way for you to fix that?
The one at the bottom, unsure. I have removed the one on the side.
There is one at the bottom as well.
Even inside it is there, yeah.
Okay, give me one moment. Let me try and see if I can share. That might be easier, and if that helps. Request everyone to just give us one second. Okay, I'll try sharing. Let's see if that helps. Okay, can you all see the slides?
Yes.
Yeah.
All right, okay, this is better, right?
Yeah.
Thanks, Anushka. Thank you to the IMPRI team, Professor Vibhuti, for the invitation again. And it's good to be back on another course and to be co-presenting with Anushka, colleague. So one of the things we wanted to highlight was one, maybe an intersectional lens, and we will speak to that a little bit more in detail later. But just today, there was this article published in Article 14, which, as you know, is one of the newer platforms where stories which are usually not part of mainstream media are published. And it speaks about a case involving a Delhi government shelter home where 14 inmates died recently, and these were inmates with a mental health disability. And this happened as recently as July 2024. But this is not unique. We've had, unfortunately, similar incidents happen in other shelter homes as well. And that tells us something about the apathy and the lack of attention which some of these issues have. Now, again, as a reminder, some of you might be aware of this, but almost 15% of the world's population, so almost 1 in 6 people, has some form of disability. And that works out to easily at least 1 billion people globally having disabilities. And specifically, if you talk about girls and women, the number of women and girls with disability is quite substantive. And the 2011 World Report on Disability indicated that this prevalence rate is around 19.2%, so almost 20%, whereas it is relatively lower, around 12% for men. And if you look at low and middle income countries like India specifically, this ratio can be even more skewed. And women with disabilities actually are the vast majority in these countries. Also a reminder that most women with disabilities in LMICs live in rural areas, and that is true of India as well. So that is another thing to keep in mind in terms of access issues, etc. Now, the issue specifically around violence, which is the topic for today, is something that has been flagged now repeatedly by multiple agencies, including the WHO. In fact, earlier this year in March, WHO did specifically highlight this as an area which needed more attention. So the issue of violence against women with disabilities as well as older women. And they highlighted how data is repeatedly showing that this is a major issue. And this is also true for subsets of violence, for example, violence from intimate partners for women with disabilities, and also higher rates of sexual violence as compared to the general population. And that is another reason why we need to talk about that. I'll invite now Anoushka to come in and speak a little bit around why looking at violence from a more policy as well as intersectional lens is important. Anoushka, over to you.
Thank you so much, Anant. So when we're talking about violence, everyone here has discussed violence for the past few sessions as well. But just to very quickly go over it, we're talking about overt acts of violence and aggression, whether it's physical or verbal abuse. We're also talking about covert forms of violence that may be more hidden, harder to spot, financial abuse or prejudice. We're also going to talk about violence that happens through inaccessibility, stopping people's access to public spaces, to public policy, as a form of violence. So interpersonal violence, the violence that happens between people, exacted by someone most likely with more power against someone with less power, and institutional violence that plays out when institutions, whether it's the healthcare institution, whether it's the legal institution in the country, educational institutions, how violence can have an effect, or even a larger effect, when it's institutional violence. So violence against women with disabilities is defined to be a problem which incorporates an endless list of injustices and maltreatment, ranging from denial of employment and social participation, lack of financial control, denial of freedom of autonomy, unnecessary institutionalization, as well as physical and emotional abuse. During today's presentation, we will be talking about violence in the natal family, the family into which you are born, in the marital family, a family into which you are married, the political sphere, the public sphere, economic sphere, as well as the institutions of healthcare and education. And all forms of such violence impact the psychosocial well-being of disabled people, and particularly those people who belong to gender minorities. So on the next slide, the reason that women and girls with disabilities are particularly vulnerable to all sorts of violence is because of various factors such as social exclusion, limited mobility, whether physical or outside the home, lack of support structures where they can seek counseling and hear people to tell them that what they're facing is maybe not right, communication barriers, as well as existing negative social perceptions, prejudices, and stigma. So, as mentioned before, this can include physical, sexual violence, as well as emotional and verbal abuse. And while these are things that unfortunately most, if not all, women in our country have to face, the fact is that the maltreatment and abuse of women who are disabled exceeds that of women who are able-bodied or able-minded or non-disabled, as the term goes. In many cases, the people who perpetrate such violence against women and girls with disabilities are caregivers, whether that's inside your home, whether that's your parents, or in institutional settings where there are doctors, nurses, judges, prison wardens. So in all of these situations, they are taking advantage of financial and social dependence and their caregiving role in order to be violent. So to the next slide, please. Thank you. I'd like to issue a trigger warning. Apologies, I should have done that before. On your screen now, you will see a lot of news clips from the last few years. There are news of violent cases that have made headlines. There is rape, there is abduction. You see that women with disabilities may be seen as quote unquote easy targets and are therefore more prone to then you can see how educational institutions may say, I'm quoting a headline that is on your screen, "Kin of ugly or handicapped girls pay dowry," says a national sociology textbook. The pandemic has worsened woes of disabled women. There are cases of disabled girls as young as 10, disabled women as old as 70, being forced into violent situations because of their disabilities. So today, as Anant had mentioned, we're going to look at violence experienced by gender minorities with an intersectional lens. What that means, Anant, could we move to the next slide, please, and then come back? Thank you. So to exist at an intersection, all of us exist at some intersections or the others. Our identity is not just one thing. I am not just a non-binary person. I'm a non-binary person who belongs to a certain who has a certain social status. I have a certain age, my nationality, my race, my caste, all of these play into the person that I am and the experiences that I have in life. So coming back to the slide before this, the reason that women, girls, and LGBTQIA people are more vulnerable to violence is because they exist at an intersection of gender, sexuality, gender identity, as well as disability. So women and girls belonging to the disability community are, of course, particularly vulnerable to violence. And that violence is even more for persons belonging to the LGBT communities. The violence is exacerbated by their queer, sexual, and gender identities. Additionally, of course, your caste, your religion, your economic status, your class status, all have an effect on the experiences of your daily life. Even within disabilities, there's a certain hierarchy. Most representation is for visible disabilities, which is often locomotor disabilities. And while persons with locomotor disabilities should, of course, have the representation that they need, it often means that there are certain disabilities that are not spoken about. And that space should be created for other disabilities as well. So coming back to the kinds of violence that we had spoken about, I'm going to talk a little bit about the sorts of violence that happen in the home you are born in and the marital family or the family that you come to belong to if you should choose to get married. So in these situations,
the systems of patriarchy and ableism, which is discrimination against persons with disability or disabled people, they converge. And there is a greater power imbalance, which makes people more vulnerable to violence. And some people get more power in order to exact violence against others. Verbal abuse, physical abuse, neglect, withholding of care and necessary support, denial of financial support that may be needed is particularly true for girls who are disabled and women who are disabled. In their natal home, this may be being neglected, not being given their medications when they need, not having the psychological support they may need, physical and verbal abuse resulting, reaching from insult to beating. And when a child grows up, if a disabled girl is married, that means that it impacts the sort of dowry demands that the family receives. There are higher chances of intimate partner violence, particularly if women and girls have psychosocial disabilities. Often because of the gendered nature of caregiving, the idea that it is women and girls' role to provide care to other members of the family and the community at large. Disabled girls, who cares for them? Disabled women, who cares for them? So there is the violence that happens in the natal home, the marital family, and there is a lack of resources available and rehabilitation or recourse that is available to them as well. At present, there is very little to no data at the national level that provides information on the domestic violence faced by queer people or disabled women with one or more disabilities. So this is the violence in the natal and marital families. The next thing is violence in healthcare. So we've spoken a little bit about one type of interpersonal violence, and institutional violence is what we're going to speak about next. So persons with disability, women included, are more likely to have frequent and greater need to seek out healthcare due to their disabilities. For various reasons, the healthcare system can be violent to such people. On the right side of the screen, you will see some factors for this, such as inaccessible public health infrastructure, the hospitals just not being prepared for disabled patients, inadequate sensitization, whether it is of doctors who are studying or doctors who are practicing, the affordability of healthcare. People who are disabled are more likely to belong to lower economic statuses, are less likely to be able to rise economically. Oftentimes, the kind of care that is needed is just not affordable, and that is a violence in itself. Then there is the stigma and prejudice that a person may face when they seek out healthcare. And finally, there are inadequate resources, inaccessible media for people to know about healthcare. For example, very recently, I learned about how there's this woman, her name is Charu. She runs an organization called Deaf Women Too. And she was speaking about how until she was a teenager, for her and many deaf women like her, there is no information available on menstruation that is in a format that is understandable, accessible for them. So in all of these ways, healthcare can be very inaccessible and violent. We know cases where health insurance is denied to people with intellectual disabilities, pre-existing conditions, quote unquote. There are concerns of autonomy and consent that come up even in the healthcare setups. In some cases, this means there are forced medical procedures such as sterilizations, hysterectomies, and in some cases, it is where concerns brought up by women or queer persons with disabilities are dismissed. There is medical negligence or dismissal when it comes to these issues that are brought up concerning autonomy and consent. Additionally, the sexual and reproductive health of women and queer persons with disabilities is a real concern. There is not enough resources in available formats, as earlier mentioned. Oftentimes, girls, women with disabilities, queer people with disabilities are not thought of as agents of their own sexuality. And that adversely impacts the sexual and reproductive health of these women and girls beyond even the forced medical procedures that they might have to undergo with no choice of their own. Very recently at a CRIA conference on sanitation and disability, the sanitation and hygiene needs of women with disabilities, clean bathrooms, menstrual products, access to a facility close enough to your home, being able to do all of that on your own, that is also something that comes under the healthcare institution. And here also we would like to flag that disability competencies, which are specific knowledges, attributes, and skills that doctors are supposed to have by the time that they leave medical education, particularly to deal with patients with disability, have been removed from the curriculum. It was due to the work by disability rights activists, including Dr. Satendra Singh, one of our colleagues, that the disability competencies were included in the medical curriculum at all. And in the NMC revised curriculum released last month, the disability competencies have been removed. So we are effectively creating doctors who do not know better than to mistreat or inadequately treat patients with disability. So we have done some work in healthcare that I'd like to briefly talk about. So there was Vaccine Equity 1 and 2. These are studies done by the iHear team here at Sangat on COVID, access to COVID vaccine for the trans community and the disability community, looking at the reasons for hesitancy, looking at how accessible or inaccessible the vaccine centers themselves are. There's an ongoing project called Access Matters that's looking at the accessibility of public health facilities in the states of Madhya Pradesh and Goa. As Anant had mentioned, a majority of the disabled population of the country lives in rural areas, and the access to a health facility itself is something that can be quite difficult to get. And then when those health facilities are not accessible by virtue of physical inaccessibility, the lack of visible signage, the lack of auditory signaling, no ramps, doctors that are not sensitive, that really creates disparity between the able-bodied and the disabled. We can move to the next. So we've talked about the institution of healthcare. Next, I'd like to talk about violence against gender minorities who are disabled in education. So looking back at where I went to college, I know for a fact that my campus was inaccessible. There was one lift for 3 floors, thousands of students. It was usually on another floor. It was usually packed full. Teachers gave a lot of readings in hard copy that would not be something that a blind classmate of mine may be able to read, that they may be able to engage with properly. There's inadequate support. Sometimes if somebody is disabled, they may need outside class support. They may need they may have support needs that are different from the able-bodied man idea that education may be built around. And all of this is only if girls and women are reaching these education facilities to begin with. Whether it's primary education or higher education, many times girls are pulled out of school way too young. And that goes even more so for girls who are disabled, sometimes even by quote unquote well-meaning parents who feel that the health institution, the education institution may not have the resources to properly educate their children. There is stigma and prejudice once girls, queer people with disabilities reach the education facilities that they have already jumped through hurdles to get to. Stigma and prejudice from teachers, from faculty, in admin policies, in examination policies. There's a lack of community, even if people get through because of affirmative action. There is a lack of social support in these settings, which is, of course, so important for psychosocial well-being. And as we saw in the headlines we saw earlier, whether it's a sociology textbook or a biology textbook, economics textbook, very often the textbooks themselves, the curriculum itself is outdated, ignorant, and harmful. So the ways in which education institutions can be violent towards gender minorities with disabilities is a wide variety of ways. I will take a quick breather. Just allow me 20 seconds. So the next thing that we'd like to draw your attention to is violence when it comes to employment. I'm sure we've talked about the gender gap between men and women in the workplace. That gender gap also exists with employees who are disabled, just the amount of employed disabled people. 47% of disabled men and 23% of disabled women are employed, as per a study done in 2016. And this is not including the work, the unpaid work, the labor that goes in to making sure our society is up and running. Even if women and queer people who are disabled have successfully gotten employed by jumping through a myriad of hoops, they are likely to experience less job stability, unprofessional or inadequate training programs, the HR processes and others, lower compensation for similar work, lack of inclusion and participation in work activities as well as social activities within the workplace. And I'd also like to talk about, when we're talking about gender-based violence, about how there are gaps when it comes to the implementation of the POSH Act, the protection against sexual harassment in the workplace, because it doesn't really consider that it doesn't consider queer people who do not belong to the binary of cis man and cis woman. It does not consider that people may be more vulnerable to sexual harassment as a result of a disability or as a result of a different factor that informs their identity. And women with disabilities and queer people with disabilities, in fact, require more protection from such exploitation and abuse than other women in their workplaces. Finally, I'd like to talk about how violence can also be through inaccessible spaces, public spaces, policy spaces. So women with disabilities are severely underrepresented in decision-making processes, whether it's national coordination mechanisms on disability matters or gender equality matters. For gender equality matters, disabled women and disabled queer people are unlikely to be included or sought the guidance of to be consulted. And then on gender equality matter, on disability matters, how often are women and queer people with disabilities consulted? If fewer women lead organizations that are community-based organizations for persons with disability, policies that are written on disability inclusion, how many people writing those policies are disabled, how many people writing those policies are women with disabilities, how many people writing those policies and enacting those policies are queer persons with disabilities. So only if there is access to writing this policy, implementing this policy, can queer people, gender minorities, voices, experiences truly be represented and be addressed. I'd also like to talk here about queerness and disability. So women with disabilities face greater violence than women who are not disabled. Then queer people, and whether that's trans women, whether that's trans men, whether that's non-binary people who are disabled, face more violence than cis women who are disabled. This is not to pit one marginalized community against another at all. This is just to understand the layers that inform the experiences we have in our bodies and in our societies. So to begin with, the disability census and even the national census is inadequate in the sense that it only registers cis male and cis female, or cis man and cis woman experiences. There is no data on queer disabled people in the country. How many are there? Where are they? We do not know. When it comes to issues of body image, desirability, am I attractive? Will I find love? Will I find someone who desires me for who I am? Can I find places to exert my sexual agency? That reduces for a queer person who's disabled. Of course, for any person with a disability, these are questions you're asking yourself. These are things that inform your experience, and that increases when you are queer and disabled. Queer people are less likely to have family support, out queer people. So that means that their access to healthcare, their access to resources, their access even to communication and discussion about disability reduces. We have on the screen some quotes. One is by Shampa Sengupta. She says, in India, while we continue to witness significant mobilizations by the LGBTQI and disability rights movement, we have rarely seen these working closely with each other. We have also a quote by Dr. Aksa Sheikh. She says, there has also been a historical pathologization or viewing something as a pathology, as abnormal, as wrong, that contributes to how trans and disabled patients are looked at by healthcare workers, and that adds to the stigma they experience. Finally, there are a couple of quotes here by Kiran Nayak. He is an activist for trans and disability people based in Karnataka. So he says, most times trans people with disabilities cannot talk openly about their health issues with doctors, and often doctors themselves are hesitant about or averse to touching us for a diagnosis. We need a safe space to talk about our intimate health problems. He also points out a very important gap. There is barely any acknowledgement of people who fall at the intersection of disability and trans identity. In organizations working for disability, they don't talk about trans people. In trans organizations, they don't talk about disability. And this is very true when it comes to feminist movements as well. The feminist movement may fail to recognize disabled people's experiences. The feminist movement may fail to recognize some trans people's experiences. So looking at how queerness and disability have very similar struggles, really, and sometimes operate in silos is very important. Finally, before handing it over back to Anant, I would like to talk about invisible disabilities and chronic illnesses. So the RPDA Act expanded on which was passed in 2016, expanded the earlier definition of disability. There was less than 10 mentioned earlier. Now there are 21 disabilities. Some of them, it has started to include autism spectrum disorder, chronic neurological problems. It also considers other conditions that were not earlier included. However, in our work, as a person who is queer and lives with an invisible disability, I feel there is a great need to expand our understanding of disability. Whether it's ADHD, whether it's chronic pain conditions, there's a host of different things, disabling conditions that impact the day-to-day lives of people that are currently not considered under the RPDA, which means that these people are not able to get UDID cards or to get state benefits or employment benefits, financial support, a lot of these things, to find community even. So there is a need to expand our understanding of disabilities beyond what is already there. We can do so through listening to the lived experiences of persons who live with invisible disabilities and chronic illnesses or degenerative diseases. Important to understand the gendered nature of living with invisible disabilities. I know it's true for myself and for a couple of other people I have spoken to, that you go to a doctor, you complain about something, and if you look like a girl, you look like a woman, the doctor says this is anxiety. That's it. That's where the conversation stops. The idea that you do not understand your own experiences, the idea that you do not have words for your own experiences and must be explained to, is also a very gendered thing. So I think this has covered that diagnosis and UDID can sometimes be a privilege. It's not a right afforded to everybody. To find community, to find care, to find medication, to find whatever it is necessary to live a life that is meaningful to you, we need to expand our understanding of disability. Thank you. I will pass back to Anant now.
Thanks, Anoushka, for covering a lot of ground around the topic. One of the areas that we wanted to sort of again highlight was the issue of an aging population, and especially an elderly population, and specific intersections with violence. And again, data indicates that elderly disabled women are at a greater risk of abuse, and those who have multiple disabilities might have even further high risk of undergoing violence. And this is something which is seen globally, but also data coming in from India. This article from Bhan Box highlighted it in the context of India. And just as a reminder that especially for elderly women with disability, there are concerns around lack of adequate social security, limited agency, social norms, often dependency on caregivers who might be abusers themselves, as well as a lack of or insufficient pension. And this is where I think for those of you who might also be researchers or planning to do research, it's an important area to highlight and flag, because what we know so far is probably an underrepresentation. And even though there is now evidence coming through that lifetime prevalence could be quite high for women around in the age group of 50 to 59 years, around 24%, and even higher perhaps for those who are older, around 23% for those between 60 years and older. But this data is limited, and there is a need, especially in LMICs such as ours, to do more work on this. And if we are able to do it, then perhaps we'll have a better sense of the burden. And this is where I think doing it right is equally important, because it's one thing to collect data, but to collect it properly and following ethical norms also becomes important. So ensuring that safety recommendations are thought through, how we talk about these populations in terms of being hard to reach versus actually not having the mechanisms to be able to reach out, thinking about risk of the research that you're planning, what kind of data collection would be appropriate, how can you ensure that more people are able to participate, how do you ensure referral mechanisms for those who might be undergoing violence, psychological support, and also recognizing role of women in the research team who are having disabilities themselves and who are contributing to the data collection, etc., becomes important. So I think for those of you interested, it'll be good for you to look at these sheets which are available from WHO and other agencies, and also methodological concerns where there are some weaknesses in the existing tools which are being used, which have been highlighted. So while there are strengths to these tools, there are also weaknesses, and perhaps that is also a pointer for us to develop better tools to be able to pick up violence against women with disability, and that would help. And this is partly why there are reporting challenges, because you might have inadequate tools, but you also have inadequate policies, standards, negative attitudes, lack of physical access, information not being available, communication gaps, lack of service provision, as well as inadequate funding. And because of the stigma around sexual and gender-based violence, especially because many times, as we know, perpetrators can be members of the family or caregivers. When we're talking about women with disability or girls with disability or non-binary individuals, genderqueer individuals with disability, it might be difficult to share because you might have the same caregiver or accompanying family member being someone who is coming to the health facility, for example, and it might be difficult for the person undergoing the violence to be able to share. So this is something we need to hence think through. How can we pick up those cues and ensure that there is adequate risk mitigation, protection of privacy and confidentiality for this individual to be able to share. And this, there is also the challenge that those women who, for example, might have an intellectual disability might have their competence and their capacity questioned. So their credibility as a witness who is reporting violence might be questioned by the provider, and that may, of course, mean that the violence is not recognized and responded to. So in our own work within the iHear platform hosted at Sangat, we've been trying to understand some of these issues better. And this was also something that we picked up during COVID in terms of trying to understand that we had a fairly large vaccination program, the largest vaccination program in the world, and were persons with disability and transgender and intersex community members able to access vaccination. And in a recently published paper in Vaccine, we specifically spoke to the structural inequities which made vaccine access and uptake difficult for these communities. And you'll see some instances which speak to the experiences of persons with disability. Major issue around accessibility and transport, because vaccination centers were often quite far, and it was not possible for someone with a locomotor disability to be able to go to these vaccination centers. And if they went there also, they might not have a very accessible health center. So that is another sort of a double whammy. The issue of tokenism, where whenever persons with disability ended up going to a vaccination center, there were photographs taken with them, put on social media, etc., and perhaps putting them at higher risk because COVID, as we know, was high risk for transmission. So this tokenism, which is often done when persons with disability come, and this whole sort of typecasting them as specially abled or differently abled, which is against the norms which the community themselves are comfortable with, is something for us to flag. Platforms which were required to be able to access vaccination, such as COVID, were also sometimes inaccessible. So for someone who might have an intellectual disability or a visual disability, the fact that if you were not able to move quickly with your slot booking, that you would have the platform timing out, or for example, the platform might not be accessible for persons with certain kinds of disability, was something which was flagged as a reason why many persons with disability could not access vaccination. And more fundamentally, this larger issue of trust. And in this other paper that we also published earlier this year, we tried to unpack this issue of trust in the health system and why there is a trust deficit, especially with communities such as persons with disability, because of historical negative experiences that they have had with the health system. So unless we address that trust gap or trust deficit, you will probably see these kinds of experiences continuing. And building on that, we now also have some ongoing work, which Anoushka spoke about, which looks at these aspects more in detail. And some of this reporting hopefully will help also contribute to the lack of evidence or data gaps that we highlighted earlier. And also, of course, we're trying to build collaborations with community-based organizations, with persons from these communities that we work with, so that they can develop skills to be able to lead this research studies in the future, to be able to advocate for the rights of the communities that they belong to. So iHear Peers for Equity was a fellowship and online training-based project which focused on building the capacity of community members. Access Matters, as Anoushka highlighted, is trying to understand how accessible are public health facilities in Madhya Pradesh and Goa by doing accessibility audits led by assessors who are persons with disability. Vaccine Equity is a project which looks at the vaccination experience specifically, but also trying to figure out how we can have more comprehensive tools which are able to pick up these cues for persons with disability and for gender minorities, because the current tools are not able to pick those up adequately. So trying to even get reform done in tools which are widely used by agencies such as the WHO. So back to you, Anoushka, for our final audience participation exercise and then the closure.
Thank you so much, Anant. Please scan this, and a question should come up on what we can do to address violence faced by gender minorities. If the technical glitch persists, then we can skip that and move to our. Avi, could you confirm whether the question is visible?
It's on my mobile, it's not visible.
Sorry, we had a query from somebody. I'll just confirm this.
Thank you.
Yeah, I just tried, Anoushka. It is working. So it has the question.
Yes, ma'am, that's working.
Thank you. Then it's 7:11. By 7:13, we'll move on to the next part of our presentation. Please do answer. This is, you can answer in one word, you can answer in a short phrase. What can we do to address violence faced by gender minorities with disability? Shruti, if you have a question, after we are done with the presentation, maybe we can come back to the questions. I see there's also one from Garima in the question and answer box.
Yes, ma'am, we do have a question and answer session planned after the presentation gets over. So we'll
Okay,
take up the
perfect.
questions. Thank you.
Thank you. I think we can move to the next slide then. Anant, do you think we can do that? Instead of waiting a little bit longer?
Sure, you want me to take that slide?
Sure.
Okay, all right. So I think we will maybe wrap up. This is our final slide with some potential solutions. We've done a lot of problem identification, and I hope all of you have been also thinking about why this is an important area to discuss in a course like this, but also why there is a need for more attention to this from a research perspective, from a policy perspective, advocacy perspective, and community response perspective. So in terms of solutions, again, we need more comprehensive policies and legal frameworks which look at intersectionality, in the way communities experience violence, and especially in terms of their identity as a person with disability, but also the multiple other identities which people hold. And hopefully when we have that data, you should be able to unpack it to understand the kind of nuances that you see, the kind of experiences across gender, sexuality, disability, and age. And it's extremely important, again, for all of this to involve persons with disability, right? So nothing about us without us is something which is not just a slogan, it is a way of approaching things. And the disability community is the one which actually has highlighted why this is important. Approaches such as accessibility audits, looking at universal design right from the way we approach our own institutions, civil society organizations, educational institutions becomes extremely important. We have some progressive policies already and a very good act, even though it could be better. But even what we have is not really being implemented. And that's where I think that policy gap is extremely important to fill, ensuring that the education which is occurring in our institutions, right from school onwards to higher education, is disability inclusive and sensitive to the needs of persons with disability, provision of accessible information systems, cross-movement solidarity, so that we have a more better understanding of the kind of experiences of violence among gender minorities, and also funding, which is a major gap, including for issues such as housing, transportation, accessibility, which can help bridge the gap for persons with disability becomes important. So thank you for your attention. Hopefully this was useful in terms of providing you another perspective and insight about the topic of this course. You can reach out to Anoushka or me or both of us if you have further questions. And as we said within IHER, we are certainly very interested in these topics and do follow our work to be able to get more insights over time. And feel free to reach out if you have an interest in collaborating. Thank you, and back to the IMPRI team for the discussion.
Thank you so much, sir. Thank you so much, ma'am, for sharing your insights and expertise with us on actions against violence and discrimination against women and with disability through various platforms like employment, education, healthcare, and where else not. Moving on forward with the question and answers, we would now open the floor to the questions from the participants. Once again, you can either use your raise your hand feature or put your question in the Q&A box. So, ma'am, as we already have questions in the Q&A box, would you like to answer the same?
Yes, sure. So thank you for your question, Garima. I'm reading out their question for everybody. Is data available of people, non-binary, with disability in public or any organization working on the same? Please share. And that you would like me to share current or ongoing work on awareness material with respect to menstruation. So I'll answer your first question. The last census in 2011 found that there were, I think, 4.99 lakh people who identified as transgender. Many trans activists believe that this number was underreported for multiple reasons. And the census itself did not include other, perhaps, quote unquote, newer identities such as non-binary. So there has been no national level surveys or census on the number. When it comes to experiences of non-binary people with disabilities, I would love to share some things that we have from our different projects engaging with queerness and health and disability. So you can write to us at anushka.virk@sangat.in or anant.bhan@sangat.in. For menstruation-related awareness material, particularly for people who are deaf or hard of hearing, I would guide you to, I'll just tell you her name. Charu Narang has a platform called Deaf Women Too. You can find it on Instagram as well as YouTube. They prepare audiovisual material, including Indian Sign Language for young girls and other people who are interested in learning about menstruation. Shruti, you have your hand up. May I request your question?
Yes, I just want to ask one thing, like as a question. I am a student of gender studies. Okay, so I have found there. Okay, if we introduce gender as a education, so it gives us a means to understand, okay, what is gender, why it is important, and why it is important to understand from school onwards. Okay, so my question is that if we introduce disability as a part of our school curriculum in terms of study, so do you think that it should make the awareness, or start making the awareness from the childhood stage, and master's level, or onwards, if we introduce subjects like gender studies? Because I hardly found, like, okay, TIS has a gender studies thing, or the private universities have these progressive study things. But when I see the our national universities, which hold so much of reputation in India, you hardly found a course on disability thing. They inculcate disability as a part of a course or as a paper, but not just as a course to understand the what are the pros and cons, how we work with the disability and the job options. So I just want to ask, like, what should be our approach for that?
Thank you so much for your question. I'll share my opinion and then I'll invite Anant to add on anything. So you're very right. Gender studies itself is not offered in a lot of universities, let alone disability studies in our country. There definitely should be. I think on how this should be taught, I am not an expert. I would just hope that anybody who's putting together a curriculum on disability studies or understanding disability, whether it's for a school level, a college level, post-grad, anything, they are looking to disabled writers and authors and researchers. As Anand said, nothing about us without us. And I think the best people to talk about the discrimination, the challenges, the victories, the needs, all of that of persons with disability are, well, us, the disability community. So there are great resources, like, what is the word, collections of resources on disability studies available. And I hope that we'll be seeing more of such available courses and curriculums in India soon. Over to you, Anant.
Yeah, I think this is certainly a gap area, and even in universities, I think centers for disability studies sometimes have been stopped. Funding has been taken away. So it's not just the centers for women's studies, but also the centers which have tried to do some work on disability studies, where perhaps there's been a little bit of a crisis in terms of support, because it goes back to our point that we need more funding and we need more data to be generated, and that can only happen when there is an availability of support and there are more researchers looking into it. But again, the lens which is used when that research happens is also perhaps equally or more important. That this should not be a lens which is cis-het, able-bodied lens. This is a lens which incorporates perspectives and ideally is led by or co-led by persons with disability. So the praxis of how we approach these questions and the data that we generate also is important. But we certainly need more to happen. And you're absolutely right that in much of our teaching and learning, including in the medical curricula, there is a major gap in understanding the health needs of persons with disability and their experiences in accessing healthcare or public services. Yeah, so we certainly need to do more.
Thank you, sir, and Anoushka ji, for your inspiring and engaging talk with us, and also answering the questions that the participants had asked. It's always a pleasure learning from you. We look forward to having you at our future IMPRI events. Moving forward, we have Dr. Advocate Audrey Director, Majlis Legal Center, Mumbai, visiting Senior Fellow IMPRI. Ma'am will present her talk on child sexual abuse for the next session. We welcome you, ma'am. The floor is yours.
Hello, hi. Thank you so much, Vibhuti ma'am, for having me here and the IMPRI team. And it was wonderful to hear the previous session, and lots to think about as to how we as organizations, as movements are looking at these issues in stylos. And I think I'm going to start on that note, which is to say that child sexual abuse. I was very surprised when I got an invite to speak about child sexual abuse. And I was thinking, why have we, come to this divide where there is women's sexual abuse and there is child sexual abuse? Because in the start of the women's movement in India, at least the autonomous women's movement in India, it started with the demand for rape law reform. And the demand came because a 16-year-old girl was raped. She was a tribal girl. She was 16 years old, and she was raped by two policemen inside the police station. And it was the entire women's movement that came together and became, in fact, the autonomous women's movement, because they came from different, whether they were labor or they were other movements, they came together as women to ask for rights. And they were asking for rights for women and children. And it's also always been one whole, because women and children in that way are so inseparable, because they are a unit. And so the women's movement has always worked at ensuring the rape law reform meets the needs of women and children, starting from Mathura, where we got in 1983 the rape law reform, which talked about, for first, it was minimum punishment for rape, also that people in authority, the onus of proof will be on that authority. And that was really the start, when after that, the women's movement, of course, has met many successes in law reform, but that was the starting point. There have been many cases, and rape is not new, and child rape is not new. And throughout this whole, from the 1980s right up to 2012, the demand was always a cohesive demand to ensure that rape law was victim-centric, was ensuring that the nuances of what victims of rape, of sexual abuse, whether they are children, whether they are women, they face, should be addressed within the legal system. To understand what their struggles were, to understand the shame and the guilt that was put on women, even though the crime was on them, to have to justify or to even talk about that abuse. And over the years, the women's movement has been part of so many important cases, and some of them involving children. For example, we had the Anchorage case in 2008, where children were raped in a shelter home. This shelter home was meant for children, and these young boys and girls were raped within that home. Or we have, if you go a decade before that, the Pete's case, the Goa case, where the whole case ran for 10 years, and it took a sustained movement to ensure that talk about things like rape is not only penovagina, because in many times objects are used to rape women and children, and this was not included in the definition of rape. And this conversation was going on rape law reform. And when we talk about stylos, right, we should have this department, that department, then we should create another department. I think what happened for the last decade, between 2000 and 2012, was that the child rights groups were asking for a separate law for child sexual offenses. And the women's groups were continuously saying that we need to reform the rape law to ensure women and children could both be included, because the issues are the same. What they face in terms of both in society and while registering the case is the same. The victim-centric approach that is required by the police, by the judiciary is the same. And so we need to look at this rape law reform to include everyone. But sadly, in 2012, we got the Protection of Children from Sexual Offences Act. And why I say sadly is because being a part of the women's movement and also being a part of the child rights movement, today one sees a very clear divide, that you get invited even at IMPRI for a child sexual offense, child sexual abuse session, and then you may get separately invited for a women's sexual abuse, but mostly you will not get invited for a women's sexual abuse session because the topic has gone out of the window. It literally has. Today, so the whole idea of getting the Protection of Children from Sexual Offences Act came because there was a huge study by the Women and Child Department, which looked at what is the level of child sexual abuse. And what they found was that it was an absolutely hushed up, underreported, not disclosed, because children have very little agency. And so even while they found the instances of child sexual abuse very high, the reporting was very low. And so there was this push to say that we need a separate law, a special law, which is different from the rape law, to be addressed in a nuanced way. And so we got the special act in 2012 on Children's Day. It is a beautiful act. I have to say, it is, in its reading, it is one of the most beautiful acts in terms of a victim-centric procedure. So you name it and it's there. For example, the child does not have to go to the police station. The police will be in plain clothes. It will be a woman police officer who will come to her residence to record her statement. And thereon, procedure after procedure, right up to the trial, just all the time tries to ensure the safety of the child at the medical, at the court, while giving evidence, in camera trial, questions will be put by the judge. So it's very, very protective throughout the process. The other very beautiful thing that the Protection of Children from Sexual Offences Act got was the idea of a support person. And as you know, all victims of sexual violence and all women and children victims find it very difficult to comprehend this very intimidating legal system. And so to have somebody whose only work is to be a support to you, not only during the investigation and the trial, but to also help you rehabilitate your life. Because when you face sexual violence, invariably, it is a complete disturbance of your entire life. And why I say that is the worry why cases are underreported. Because the moment you report the case, in spite of all the confidentiality clauses, everyone in your surrounding comes to know, which would happen in any case, right? Media may report, police come to your place. There's lots of, activity happening. You may be in a hospital, you have to go for medical. And all of that creates this whole aura, which does not allow you to continue residing in your own home, because then it is like she is that victim of rape and she is the one who did something and what happened. And then that shame makes you just not want to be in that area, not want to continue. And especially when it comes to marginalized, poor, women whose lives are out in the open. If you're living in a slum, if you're living in a rural area, you're more exposed and everyone knows about it. So this idea of a support person is really, really helpful to be with you, to help you with this rehabilitation process, help you with the legal process. Now, the other good thing that the Protection of Children of Sexual Offences Act did was it included both boys and girls. So earlier, the rape law would only speak about women. And when we say women, it was women and girls, right? So there is a misconception that child sexual offense abuse was permitted before POCSO Act. But that's not true. Child sexual offenses was never permitted. Rape was always a crime for women and girls. And rape of boys was also a crime under Section 377, which defined unnatural sex as a crime. But POCSO did a huge effort to say that children are both boys and girls, and both can face sexual abuse, so they will both be included as victims. But then it did the unthinkable. And when I say it did the unthinkable, because it raised the age of consent to have sex from 16 to 18. And one can only see the underlying motive of this government of wanting, or whatever you call them, supposedly the ones who are there for our protection, the insidious way in which they brought it, because age of marriage was 18. And so they wanted that you will not have permission or you will not have agency to have sex till 18. And then age of 18 is marriage, so we can get you married. And that was, women's groups objected to it so much. But there was no voice for it because they said, no, age of child is 18 and we want to keep it at 18. And so what it really then became is that you cannot give consent to have any sexual activity till the age of 18. And we all know that our sexual attractions, our sexual exploration starts at the age of 13 or sometimes even earlier. And women are attaining puberty so much younger. So while they're attaining puberty, while they have sexual attractions and sexual explorations, if they had sexual activity, and when I say sexual activity, it means any sexual activity, it would be considered a crime. And that was the most shocking thing that let get passed, right? But because child rights groups were pushing it, women's rights groups were not able to push the voice so high, because it seemed like you were opposing the child rights groups. And so you let it pass. And with that, what else did you let pass? You let pass something called mandatory reporting. And like I told you, the research threw up that there was, a lot of underreporting in child sexual abuse, which means parents were underreporting, teachers were underreporting, counselors were underreporting, because children have no agency. And so everyone would hush them up. And so what the law said essentially is that anyone who knows about the child sexual offense is mandated to report. And they added another layer to say that if you do not report, that is a crime. So look at this double-edged sword. You are telling girls and boys that you can have no sexual activity till 18. And even if you do it consensually, if there's anybody else who knows that you are having sexual activity, they are mandated to report. And this is what they brought out as a law. And the third thing which disturbs me immensely as a human rights activist is the onus of proof is on the accused. And we know the state, as powerful as it can be, when it wants to get after an individual person to put the onus on the accused, is, for me as a human rights activist, the greatest betrayal. You bring it in the name, you bring this law change in the name of women and children, but you are violating basic principles of human rights and our constitution, which says that the all-powerful state, the onus of proof should be on prosecution and not on the accused. But everyone was so excited that, because when it comes to sexual abuse, we have a very fervent and very angry reaction, which is we are constantly bidding for blood. Every time we hear a case like the Badlapur rape case, whether we hear the Arjika rape case, when we heard the Nirbhaya rape case, when we hear every rape case which shakes our morality or shakes our very being, then we want to demand death penalty. And now you have an accused who has the onus of proof on them to prove that they did not do it. So for me, Protection of Children from Sexual Offences Act is a wonderful, wonderful law, giving a lot of victim-centric approach to victims, which I cherish and use a lot because my work involves being a support person for victims of child sexual abuse. These three things that the law had was very, very shocking and very disturbing for me. The year was 2012. It was November 2012. The law would have come quietly and everything would have gone on. But what happens in December 2012 is the Nirbhaya rape case. And the Nirbhaya rape case completely shook the entire country. There was a lot of anger against the police, against the whole system. There was a demand for death penalty. There was a lot of candlelight walking and, asking for reform in the rape law. So what happens? 2013, the rape law gets amended. You would have thought that that was a good time to integrate and see how do we make this happen. But what they did was, in the criminal law amendment, where age of consent was 16, they raised the age to 18. Why? To bring it in line with POCSO. So now even the criminal law is saying 18, POCSO was anyway saying 18, and then they started putting in the stringent punishment bits, right? Because it was a demand of the society. It was a demand of the parliament. So today we are holding, and I'm not even going to tell you about the 2018 amendment, which brought in even more criminal incarceration of the rape law. There was anything more than death penalty, they would give it, right? So we are holding these two, what we call rape laws, in our hands. And that is where the work of Majlis lies. So we are a team of women lawyers and social workers, and our work is about providing access to justice to women and children. And we help women and children to navigate this very difficult, intimidating space of accessing justice. I want to, tell you a little bit about, because that's my space, about what is happening in the criminal justice system when their response to women and children facing sexual violence. So, firstly, even though the law talks about such beautiful procedures within the police and the judiciary, the reality on the ground is nothing of that sort exists. And unless you're fighting tooth and nail and screaming and shouting at the police station, nothing gets done. And I'll give you an example of that through a case that I'm just writing a complaint about, where a 15-year-old girl whose mother is a single mother, has left home, and the mother was very, very worried. So mother goes to the police station, and this is a case I'm telling you has happened 2 months ago, and it's in Bombay, in the heart of the city. Her mother goes to the police station and files a missing complaint, as she should, because she's really worried about her child. 4 days later, the girl returns, and she tells her mother that this very close friend of hers drugged her and took her to his house. He is 23-year-old. She's 15-year-old. He drugged her and took her to the house, and he confined her for 4 days. And when she managed to regain consciousness and was able to hold her own, and then negotiated, and she left. So the mother and daughter go to the police station, because now a missing case is filed. So they have to go and report and make the victim statement. When they enter the police station and the girl tells her story, the police officer starts abusing her and insists that she is lying. And he's threatening her and he's telling her, if you don't tell the truth, you see what I will do to you. So no believing her, no recording her statement, no woman police officer, no plain clothes, no home, nothing. In fact, this is now almost intimidation, threatening. He then tells a woman constable to take her to an inside room where she beats her with a belt so that she will tell the truth. When in spite of that, she keeps saying, and her mother is not allowed to enter. They try intimidating her in all kinds of ways, saying you're lying, tell the truth. And then finally, they make her mother leave the police station and go home. And they keep her overnight at the police station in that officer's room because they want her to tell the truth. So they think that they will intimidate her and frighten her and she'll tell the truth. Next morning, they call the accused. And the accused comes to the police station. 23-year-old boy, 15-year-old girl, they make them, that they're all like, there's a big shouting all going on. And then when the police go through this boy's mobile phone is when they see these photographs in a compromising way of the girl, that finally they say, okay, now we'll record the case. And then they record the case. Right. And then after that, of course, a lot of things happen and the girl is moved to the shelter home because the mother is also now very scared and says, I can't have this child in my home because I can't take care of her. I have to work. And if she does this again, I don't know how to handle it. So mother puts the child in the shelter home. Now, what does the police do? At the time of, so the accused has filed a bail application. He wants to be granted bail. So you know what the police does? They go to the shelter home and they tell the girl that, firstly, make her feel very guilty that the accused is in jail. Then they start telling her that you went out with him. It's all your fault. And now this poor guy is in jail. It's all because of you. So anyway, now you're in the shelter. He cannot harm you. So you should agree to his bail application. So there is a procedure in law where and we've got this after a lot of struggle, that if the court is granting bail to an accused in a rape case, the judge should hear the victim. Because if she has any fears, it should be recorded. But the police has intimidated her so much that before she even reaches the police station, she just goes and says, I don't have any objection to his bail. And what I'm trying to show you here is at one level, you can bring all the procedures into law. We can sit and talk ad nauseum about how we need to change this law and how we need to bring this, add this section and add this procedure. But if you want to understand how law works on the ground, it is a completely different ball game. It is all about negotiation. It is all about class. It is all about power. It is about, caste, religion. Everything plays a role in how the state responds to you. And so while at one hand, you will be, saying how India has such a great rape law, how we have the child sexual offense law, how we have the, such stringent punishment, this is typically how a case will flow. And we thought, okay, women are excluded. Women above 18, they have to fend for themselves, all that. And you would think children would be protected under 18. But that's not the reality. Because in a way, as a society and also as a legal system, we have an idea of an ideal victim. And how does this ideal victim look? Ideally, she should be very young. There should be a lot of injuries on her body. She should have resisted violently. And if she is dead, then it makes for a perfect victim. But as the age of the victim increases, and when I say age of the victim increases, even girls as young as 12, they are not believed. There is always the presumption and the assumption that she asked for it, she went, she consented. So even while the law says she cannot consent, when it is convenient, she is told that you have consented. And the only time that this law is used, sadly, is when the girl makes a choice to be with a person of her choice because of whatever reasons, and the family is opposing this, and the family is against this relationship, it is at that time that the POCSO Act is brought in and a case is filed. Because unless we understand the way these couple of laws are working together, one is child marriage, where child marriage continues to take place in our country with the consent of the parents and all the families, and everyone attends those weddings also, and there's no problem with that. But basically, this law, as all other laws of violence against women, is only used when they want to control the agency of women, when they want to subjugate them, when they do not want them to make choices. This is how it is used. Should you still file a case of sexual abuse? Should children still use the law? I would say definitely, absolutely. Because let me tell you that I've dealt with so many victims of abuse, sexual abuse, and there is a difference between the victims who have reported and the victims who have not reported. So while the victims who are reported are very frustrated with the system, they're very angry of the long wait, they're very angry of how they were treated, they still feel a validation that they did something, that they raised their voice, that they did something. And the ones who reapproach us sometimes 20, 30 years after the abuse, the feeling that they were not validated, the feeling that they did not get an acknowledgement of what happened, is something that they struggle with all their lives. So I think that, there is an urgent need for us as a society to relook at how we are looking at sexual abuse, whether it's children, whether it's women, because the more we are giving it's worse than death kind of image, the more shame women are feeling. And I don't know how to explain this, that you are putting so much behind this rape law that you're almost telling girls that if you are raped, that's the worst thing that can happen to you. And I wish to tell women and girls that this is a crime. It's not a morality issue. It is not a sexuality issue. It is not that if you are raped, you cannot live a full life. And you will have to think of it as a crime, and you'll have to deal with it as a crime the way you would deal with any other crime. If somebody, broke your hand, hit your head, broke your head, how would you deal with that? It is an horrible, horrible crime, but it is a crime, and it's not a reflection of your sexuality and your morality and what you are as a woman or as a child. And so we need to create this distinction, and we need a focus on accused. We talk about accused as if to say they come from some dark jungle and then they rape and then they go back. That's not who accused are. Accused, in my opinion, and this is national statistics, are 90% known people. And who are these known people? They are your neighbors. They are your school. They are your family friends. They are your family. They are your fathers and brothers and uncles. This is where the cases are, right? A stranger coming from nowhere and raping somebody is very rare. It is such an important understanding, and since we are talking about intersectionality, is to understand domestic violence and sexual violence and how integrated they are. Because currently it is, oh, this is a seminar on domestic violence, now this is a seminar on sexual violence. But really, what is happening in homes, right? It is about that when there are small instances of sexual harassment, or when there is teasing, or when there is, these what we call not so serious cases, there is a complete turning of the eye towards it. The family is forgiving of that, for allowing men to get away with it, not addressing it. Men are abusing their wives, abusing their daughters, and within all that, women have less and less agency in the public space, because they're already so small and made to feel like they cannot do anything. And when abuse happens to them by family members, it is this family who then says, you should not say anything, because patriarchy works in that manner of not allowing women to complain about the very family that abuses her. And so you continue believing or letting men go and get away with the small instances, which then makes them feel more confident to increase the sexual abuse that happens. And we were very shocked when we recently studied data of Maharashtra on child sexual offenses. And what we are noticing is, in some level, in some way, penetrative sexual assault is getting recorded, which means the penetrative sexual assault. But when it comes to sexual harassment, not even 5% cases are recorded of the total POCSO cases. So what it's saying is that sexual harassment is muff. And as the confidence of this person increases, because nobody just commits rape. You start with the small incidents, you get away with the small incidents, you become more confident of that. And that's how you reach a level where you think you can commit an act of sexual assault. So we need to turn this issue on its head. It's really time that we understand where are we going with this law? What is it serving? What are women and girls asking for from the system? And then think of how we can make this crime of child sexual abuse be looked at as a crime and not as a moral function of children are getting sexually abused and women are getting sexually abused. So I'll pause here and would love to hear what you have to say.
Thank you so much, ma'am, for such a great session. It was a very great session and an insightful session, of course. Thank you so much for sharing your personal experience as well, and how uh, your organization, tackles when people come with the cases and how the victim has suffered through. I would now like to call Vibhuti ma'am, our chair for this session, for her comments on this topic.
Yeah, I think when it started, like in case of Mathura, first of all, police was not even ready to write the FIR. In so many such cases we have seen. So that it is the context in which the women's movement had demanded mandatory report, because during 80s, all our demonstrations and Gherao and sit-in and picketing was just to get FIR written, whether it was a case of a construction worker, minor girl who was gang raped by the bootleggers, or a question of a blind beggar who was raped on the pyramid, or or a young girl raped on a railway station. Police just would not write. So it is in that context that the women's movement had demanded. But now it's a double-edged sword, because what happens, like the dilemma that she has to face, if she gets reported, then there is a naming and shaming, pressure on mother. That also we experience. A girl, 6-year-old girl was raped by a neighbor, from Valmiki Samaj. Mother wanted to fight it, but it was the community leaders who said that nobody will marry your daughter. What's going to happen after 10 years? So I think the social pressure is very, very important deterrent also, and the stigma. I think that we are facing, that the survivor has to face. In fact, most of the feminists, first time they ever discussed their experiences of child sexual abuse was in 1985 conference, which was called the National Conference on Rape. And most of them very, very articulate, very brave, and those who have written extensively on this issue, they also say that for the first time they are talking about it, whether when they were raped by the doctor in the examination table, or by the watchman of the school, or by the school bus driver, or the private, the chauffeur of their father, whosoever. They said they had never discussed. So even those who are at the forefront and championing the cause of women's rights and who pioneered work on gender-based violence, even for them, it was the safe space was never provided. Not only that they did not confide to their parents or a favorite teacher or a sympathetic friend, nothing. This was a taboo subject. So I think we need to understand this historical context, and currently also the major debate, especially among the medical profession, that once you talk about the once they have to do the mandatory reporting, the patient and her mother, they just stop coming. No, patient stops coming because the care which she needs, in fact, the STD test or the injury, bodily injury that she has, even that she doesn't get any medical care because of this whole demand of mandatory. So it is a very, very painful reality. At one level, we demand that every episode, every tragic incident of gender-based violence needs to be reported in the criminal justice system. And on the other hand, these are the consequences that you face when you do and we have, there is no consensus currently. Also, a big polemics is going on in the women's movement about mandatory. When you are working at the ground level, I think you have to go case by case. What is like Jyoti Singh's mother? She had no problem. On the contrary, why are you calling her Nirbhaya? She said, why are you calling her Nirbhaya? My daughter had not done anything wrong. Or currently, even in the car case in Kolkata, the parents have given the name of their daughter. The media and all, they were following the clause of anonymity of ethical reporting and all. But the parents said, my daughter was doing useful, valuable work to the society. She was saving the lives of people. She was an honest and a very committed and sincere doctor. Whatever has happened to her, the accused is at fault. And my daughter, we are proud of her. You rarely get such parents, or you rarely get such response to the even in Nirbhaya's case, the kind of sadhus and all, the kind of things they were statements, such inhuman and insensitive statements they were making. They are like Asaram Mapu's statement about rape and why it happened. Women should have a character of a Sita so that no Ravan can cast his evil eye on her body. These are the kind of statements which were made by the saintly people. So in such a strong misogynist atmosphere, it's really a very difficult person for a person who is for the women's groups who are doing the handholding, and I think very few are doing, and much is one of them.
Thank you so much, ma'am, for your remarks on such a insightful and a very, empowering session about the same. We will now move forward with the question and answer session. So we open the floor for the questions. Participants can use the raise hand feature or enter their questions in the Q&A box. Ma'am, we have a question from Arunji. Arunji, could you please unmute? Yes. Thank you, sir. I'm sorry, sir, you're not audible.
Is this better now?
Yeah.
Okay.
Now we can.
Yeah. Now, there was one thing you mentioned, Advocate Audrey de Mello, that things go, well, there's a general non-reporting issue, but more often than not, until it gets to penetrative sex, it is not reported, and it just escalates or gives the perpetrator license to go on. Now, how do you address that? It's the accused, the perpetrator, it's the family, it's the community, it's all of that. And on the one hand, you have training, education about good touch, bad touch, starting from kindergarten, at least in the West. That's what I've seen with my kids. But even that is a taboo topic in India. You don't talk about these things. So there is an aversion to address the issue, and then, because of underreporting or because of just ignoring it, in a way, you are giving license to the perpetrators. How do you address this issue as a society?
Yeah, I think you very well said that, how in our families growing up, we tell our children to be careful about so many things. We teach them about how to, cross a road, how to do so many things, but we never tell them that if you are sexually abused, you should do this, or you should be able to come and talk to me and explain to them what sexual abuse is. The second thing which I feel is that because our criminal law is so skewed, and it has become increasingly so with this demand when it comes to sexual abuse of women and children, that the punishment is going to an crazy level, right? So the sexual harassment punishment is 1 year to 3 years, right? So, but the expectation of a criminal justice system is that if the punishment is so high, then your case has to meet so many requirements. And women or girls are not ready to make that commitment to the criminal trial that is expected of them. What they want to do is report it, but not have to go through the entire trial. So somewhere we need to address it by minimizing, first of all, reducing the punishment, and then minimizing the whole process so that it is addressed and curbed right in the beginning. Because if that child has to report, or this woman has to report sexual harassment where somebody said, touched her in the bus, somebody groped her, somebody, made a comment, all of these are crimes as sexual harassment. But every time, even me, I would think, like, am I going to go through this entire trial and report, and why? So we need to understand how to reduce the expectation of the trial, and while doing that, also reduce the punishment. It could be community service, it could be anything, but reduce it in a way that more people will report the crime. So that
The burden of seeking justice.
Yes.
It's too
No,
heavy.
and also even the attitude of the state, no? Because see, our organization, we want to, in our training module, if we include about safe sex and all, the municipal schools, we won't have entry. What we are writing personality development. And within that, we have to teach them. At least POCSO case now, it is in PTA meeting and all, it is there on the agenda. People are. So one advantage I find with the POCSO case is that now at least we can discuss with the children, with the school authorities, with the parents, and also with the teachers about what kind of crimes are happening. I remember just 10 years back meeting Commissioner of Mumbai with a friend who was in a forum against child sexual abuse. PEXI was an organization. After that Goa case, the pedophilia case, she had come up with a pictorial book on safe sex and unsafe sex. And when we approached the Commissioner of Mumbai that why don't you get it published? It's in Marathi, children can understand, and in VMC school make it compulsory. The commissioner said that children will lose innocence, ma'am. Your priorities are wrong. You should be doing more about the population control rather than working on such issue. Our children will lose innocence if you talk about such things. No? So if a person in the decision-making body are totally insensitive, they are in their own safe world, who can't even imagine what is happening at a ground level. Because this booklet came out after a series of discussion with the community-based organizers, where they say the children are refusing to go to school because of so-and-so person is behaving like that. The watchman is telling them to go to the terrace, and then they ask them to remove their pants. So these are the kind of, so many such reports were made by the organizations working in the community. We had decided to come up with this booklet. So I think we need to more sensitive people, even in the governance structures and even the politics, even the previous session about the person with disability. It is, unless you have a representation and voice, things will not be, you will not have agenda setting power. So I think now we should aim more at that level. No?
Ma'am, we also have a question in the chat box by Anushka ji.
Yeah. Anoushka ji, you can speak.
Hello, thank you. That was an excellent talk. I'm really keen on knowing how you envision a non-carceral form of justice where we're not baying for blood, where we're not looking at what's capital punishment, and we're looking at a more rehabilitative, perhaps, form of justice where still the survivor's needs are met.
Absolutely, absolutely. I'm telling you, Anushka, every time I do a case, and usually when Majlis does a case, we are providing so much support to the victim right from the beginning that invariably she gives a very good testimony and we get a conviction. But that's not our program. Our program is victim support. But let me tell you, every time we get a conviction and it's 20 years, my heart sinks to my knees. It just feels that I don't know what we're doing. I mean, even my victim feels like, because this is a father, this is an uncle, this is a family member, uh, and just how much she struggles with that burden. So, demanding this incarceration to this level is not serving a purpose. What are we trying to do here? It should be the question that, you and for judges. I find that the most important aspect that I notice is that no judge wants to sit and put somebody in jail for 20 years because, firstly, they don't think of this as a big crime, right? They don't think of rape and sexual abuse as a big crime. But having said that, they don't want to put him in jail even though they know it happened, because they'll say he's a first time offender, he's a young man, he's married, he has children, there's always something. But my point is that in order to say that he did not do it, then the flip side is to say she lied. And that for me is so sad that that should be the outcome of it, that you don't want to incarcerate somebody for, whatever period of time. So then you say you are a liar. And so who is this serving? And I think we would be much better off pre-1983, where we did not have minimum punishment. And we could work with ensuring, but like Vibhuti said, every time something happens, uh, we want it to work. We want it to work for that victim, for that particular case. And then sometimes we make demands, and then when it actually gets used, we see how different it is. And so a case to case, but then that has its own problems, because then you have the caste and how minorities are treated within the justice system. It's very, very complicated.
Thank you.
Thank you, ma'am. We have one more question by Priyanka, ma'am, and the question is: are there any examples of more effective legislative measures in place in other countries that India could learn from?
Yeah, I don't know whether it's effective, but I'll share with you how the US deals with this. I think it's problematic, so I'm not saying that I agree with it. But as opposed to India, you can go to a police station and they have to file an FIR, right? The filing of the FIR is not negotiable. They don't do it, that's another matter. But in law, it's required. Whereas in the US, you cannot straight away file an FIR. You have to prove, the police have to prove to prosecution that this case is worthy of prosecution, and only then this case goes for trial. And that is also problematic, but that's why they have such few cases. Because prosecution will not take a case forward till they are convinced that they can prosecute. But that's the system in the US.
Thank you so much, ma'am.
I feel we are trying to resolve an issue purely through legislative and judicial means. And that's the problem. If we don't tackle it as a social issue, a moral issue, a behavioral issue in the upbringing of our population, starting from a very young age, what are we doing here? On the one hand, we are being very moralistic and Victorian. I don't know what the other word would be. in the upbringing of our children. And then we are surprised that all this happens. Rather than, as I think you put it, normalizing sexual exploration, which is human behavior. So there is a catch there in that we are conservative in our social outlook and then excessively legalistic when it comes to retribution. And I think that's where we have a problem. I don't have a solution, but I'm trying to state the problem.
Thank you so much, sir. Moving on forward, thank you, ma'am, for your inspiring and engaging talk with us and answering all the questions that the participants raised. It's always a pleasure learning from you. We look forward to having you at our future IMPRI events. This brings us to the end of our session. We thank Dr. Anant Bhanji, Anushka Virk and Advocate Audrey Demello for sharing with us their insightful discussions on addressing gender-based violence through the vital role of health professionals, through how disability and how I'm so sorry. One second. Thank you, and we hope to collaborate with you for the future events as well. As we move forward, I would like Vibhuti ma'am to present her closing remarks for the session.
So I think both the sessions are extremely important because they are not much debated. Even in the mainstream discourse, the problems of the persons with disability, it's a tokenism, as Dr. Anant Bhan said, and also when the question of so many controversies which are happening around the child rights and why child rights groups and the women's rights groups are not converging to have an intersectional solidarity. I think that is also a very major challenge that we are facing. Only laws are not going to do anything. Even if we have a foolproof law, the societal attitude, the gender norms, the gender biases and misogyny existing in the criminal justice system and governance structure, I think that we have a very, they are creating a very, very negative environment, disabling environment. So I think it is very important that educational institutions, criminal justice system, we as a conscious citizen, and also the women's rights groups, we all need to keep these issues center stage and discuss and debate them in a very, very serious manner, not as a tokenism, but as a very important crisis. Another very important learning that we have had of the women's movement or any social movement is creating our own community. People who are thinking alike, who are on the same wavelength of sensitivity and sensibility, we need to come together. We need to create a community, not only professionally, but even as human beings, for hand-holding, supporting, sticking out our neck when our friends are in difficulty. Because now the people from the queer community have started taunting us that, okay, we are together and we share the podium where in terms of platitude, we all are talking about solidarity and this thing, but none of you would invite us to your home. Okay. And there was a Shabnam Hashmi had started a campaign to counter the Islamophobia. Mere ghar aake to dekho. It is knowing them that how you live. So the lived experiences in a day-to-day life, that kind of solidarity, unless we create that isolation, will not go. Feeling of loneliness resulting into depression, and also we noticed during the pandemic, so many people from queer community committed suicide. They were completely socially isolated. These others were keeping in touch through their WhatsApp group, and their relatives were ringing them up, or they were keeping in touch. But the community life is so important. So I think we need to have our own social capital, I think, as the sociologists talk about, because it is not only your mind that has to be convinced, but your heart also has to be convinced. I think that's what is the learning of all three lectures, all three presentations we got from Dr. Anant Bhan, Anoushka ji, and Adv Dr Demello. And all three of them brought in so many different dimensions of the lived experiences. No, though Majlis enters through legal, But Majlis is not only providing legal support, they do hand-holding from day one of the survivor, and they see to it that their livelihood needs, their needs of companionship, their needs of a community, that there is a joy and interest in the life. That is also extremely important. So I think this is what we have learned, that law alone is not going to, and I think you were right when our partner Arunji, when you said that we can't be just concerned about the law and the criminal justice system. What are we going to do as a community? That is a major challenge. Now the ball is in our court.
Thank you so much, ma'am, for your remarks on the session today. Moving forward, as we come to the end of the day 7 of Ending Gender-Based Violence, Cohort 3 Challenges and Responses, an online national autumn school program, a 4-week online immersive certificate training course. I, Avi Sharma, a researcher at IMPRI Impact and Policy Research Institute, would like to propose the formal vote of thanks on behalf of the IMPRI Gender Impact Study Center, New Delhi. We are grateful to our chair and experts for the 7th day of this program, Professor Vibhuti Patel ji, Dr. Anant Bhan ji, Anushka Virk ji, and Advocate Audrey ji, for taking their valuable time and for their thought-provoking insights on the topics. We thank all our participants who have raised pertinent questions and actively participated in today's deliberation. Readings for the session have been shared in your email, and a video of the session will also be shared with you for your learning. We look forward to welcoming you for the 8th and the final day of this certification course on 8th of October 2024, that is tomorrow at 6 p.m. by experts Dr. Padma Diosthali ji and Ms. Jayashree Velankar ji. We are grateful if you are watching us later on YouTube, listen to us on our various podcasts, and read about our publications. We hope you continue to join us in the future IMPRI Policy Talk and Web Policy Learning events. Wishing you all a very good evening. Thank you so much.
Thank you. Bye-bye.
Thank you, Avi. Yeah.
Thank you so
Thank you
much.
so much.
Bye.
Thank
Thank
you.
you, ma'am.